So this is how much the hospital systems have changed. 20 years ago, maybe more than, more than 25, maybe 25 years ago. I worked at a hospital. I wasn't a nurse yet, but I was like a tech unit secretary kind of thing. And I worked on a labor and delivery unit. And it was a hospital that I don't want to say they would do abortions, but they were strict about that there was they were 100% sure, like, that the baby had died, that they wouldn't do it like for Down syndrome, stuff like that, okay? But if the parents they would tell the parents, and then if the parents wanted to have the baby, they could. If they didn't, then they would end the pregnancy. It had to be a major, like, a hole in the heart, that kind of thing. If it was past that time period when you could have an abortion. So the hospital was understanding enough that they would not make nurses take care of those patients if they didn't want. So if a nurse had a religious problem with taking care of a patient having an abortion, they would just put another nurse with them, even if they had to call a nurse in. That would never happen today. Never. 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 You would never be able, for a reason like that, because look at what they did in 2020. The healthcare systems had determined, we don't care what your religious views are, we don't care what you think. If you want to have a job, you will take this shot. Coercion, horrible manipulation. So when I say the healthcare systems weren't always the way they are today, they weren't. They weren't. It's just, for any new nurse, that would be shocking to think that a nurse could say, I'm not comfortable taking care of this patient because of religious reasons, because of the abortion stuff. Yet there was a time when hospitals would respect that. They would make sure that the patient was taken care of, but they would also respect their employees enough to understand that not everybody has the same views. And some people are not comfortable with that, and it's not that they have anything against the woman having the abortion, or like I said, this wasn't an abortion clinic. It was a major big hospital. So and again, they did them because there was something like real congenitally wrong. But they would not ever force a nurse to do anything, especially against religious reasons. Now, obviously, you can't just say, I don't want to take care of somebody psychotic because it goes against my religion. But the abortion issue has always been one that's a contentious one. It's a delicate one. And employers, the hospital systems used to know how to balance that. Okay, they used to have a whole list of nurses they could call in if need be. And now they don't, they cut staff to where it's like, soon I don't think I think the laws will change and registered nurses won't be required to take care of patients. Yeah, I mean, I could see it. I could see it with as bad as the healthcare has gotten. Now, obviously, that was back in a day when, before Obama, and obviously he's not to blame for everything, but he put a lot of the nails in the coffin, let's say, because Obamacare is what changed the way staff was treated, how much staff you had. It gave all this power to unions. They put in all these CEOs that are just heartless people. It changed it to where you had businessmen running the hospital instead of the medical directors. So when you have good physicians running the hospital, good medical directors, good ones, I mean, they will see things from both, they understand from their, their education. and what they're supposed to do as a physician versus, being the keeping the hospital open because of money and insurance and all of that. That's when the hospitals ran well. Now we have businessmen running them. And I have nothing against businessmen, but they have no business getting in healthcare. They really don't, because they're all about business. Whereas a doctor, most of them anyway, usually, are about caring for a patient. So that's how much it's changed. And Obamacare took us into socialized medicine. And then what has come from that is all of these nurses rising up because they don't have enough staff, and they don't, but it's all socially engineering nurses too, to go running to a union. And again, then that union is your babysitter. The nursing profession and the medical profession has been so socially engineered. And you can forget for the new ones. The new ones, they're seeing a healthcare system, they just think that this is always how it's been. It hasn't, though. It hasn't. They didn't used to demand that you get all these injections. They didn't used to demand that you take these patient loads that are unsafe. They didn't demand. I mean, there used to be a collaboration between managers of a unit, between what they knew their staff wanted and the higher ups. Now the higher ups just tell you what to do, and these HR departments, well, they just go along with whatever the higher ups say, because they determine who's going to get hired and who's not. They're going to determine whether you are, going to be the type of slave they want. And that's what it is. When you take away a nurse's ability to choose whether they want to have an injection or not, then you have become a tyrant. I don't care if you want to call yourself a medical business tyrant, a hospital tyrant, a medical doctor tyrant, but you have. And the very fact that there's not enough people in healthcare that are standing up and saying that, well, it just shows how much social engineering and brainwashing has taken place. Because the healthcare that is in place today, which has gone down the toilet, well, 25 years ago, 30 years ago, we had a good healthcare system. And now we have leaders in healthcare at the top of the associations that have destroyed it. And yet they want to say it's for all these other reasons. No, apparently they forgot what healthcare looked like before Obamacare, what healthcare looked like 25, 30 years ago. People were not controlled. Everything was not, oh, we do things one way. People were allowed to think outside the box and do what was in the best interest of patients, and employers respected nurses and doctors. So, yeah, that's where socialism takes you. Thanks, Democrats and rhinos.